Welcome to part 2 of our conversation with Dr. Caroline Day, menopause and hormone therapy expert. In this episode, we go deeper. We're tackling your most burning questions. Is there a best age to start hormone replacement therapy? What benefits does Dr. Day see in her real-world practice that don't always show up in the research? How do you actually find a qualified hormone therapy provider near you? And are those perimenopause supplements that are flooding your Instagram feed even worth it?
If you missed part 1, start there or make sure you circle back later. We've covered the fundamentals in it: patches, creams, pellets, pills, what works, what doesn't, and who should even consider hormone replacement therapy in the first place. Now we're getting into the nuance. Let's dive back in.
Caroline J. Day has been a physician for over 35 years and is board certified in family medicine. She graduated from the University of the Witwatersrand in South Africa in 1988 and went on to gain extensive experience in pediatrics, urgent care, psychiatry, and geriatric medicine while living and working in South Africa. She also practiced in the United Kingdom in hospitals in and around London. In 2002, she and her family relocated to Tuscaloosa, Alabama, where she continued her medical career in the United States. In 2015, Dr. Day became board certified in anti-aging and regenerative medicine. She is a member of the American Board of Family Medicine, the American Medical Association, the Medical Association of Alabama, the Menopause Society, and the American Academy of Anti-Aging and Regenerative Medicine. In February of 2017, she opened Tuscaloosa Integrative Family Medicine in Northport, Alabama, fulfilling her dream of creating a practice that provides exceptional primary care for both acute and chronic medical conditions, as well as hormone therapy and personalized weight loss care. Her passion is preventative and integrative medicine, helping patients not only live longer, but live better. Her approach blends evidence-based traditional medicine with modalities such as bioidentical hormone therapy, nutrition supplementation, and detailed life-changing patient education. Dr. Day has been awarded top family physician in her local area for the past 6 years and was recognized as the top family physician in the state of Alabama in 2022. In 2024, she completed a fellowship in anti-aging, metabolic, and functional medicine and became a Menopause Society certified practitioner. Outside of medicine, she enjoys traveling and bicycling with her husband, watching movies, baking, and spending time with her adult children and elderly father.
Dr. Day also happens to be my physician and my favorite healthcare provider, and she has been overseeing my hormone replacement therapy for several years now. I've been hearing something about the age of 65. Like if you haven't started it by 65, what is that?
Yes. So the Menopause Society has started to change some of their thoughts, especially with the removal of the black box warning now. And so now most of the menopause and OBGYNs will actually say, yes, we can now use hormone therapy up until about 65, which is much better than it was.
Yeah.
When it was basically you can't use it at all. I do use hormone replacement on patients who are over 65. You can really use it for as long as you want. I mean, you're using it so that you can function better and age better. Mm-hmm. But you do have to change the way that you do it. So the controversy with over 65 is because estrogen, whether it's synthetic or bioidentical, can increase some of your inflammatory markers like your C-reactive protein if you already have some form of heart disease. So if you have not done any hormone replacement and you get to 65 and you've maybe got diabetes or high cholesterol, you are going to have some form of endothelial dysfunction in your cardiac arteries or plaque buildup or whatever. And so what they're saying, and then adding the estrogen, particularly by mouth, as I said, that's the problem. It's more thrombogenic, i.e. could cause blood clots. but it can also cause more inflammation. But if you use the estradiol, the bioidentical transdermally, it has not been shown. So the caveat for me with over 65 is I'm not going to use oral estrogen, but I will use transdermal estrogen. So the sooner you start hormone therapy, the better. But at the same time, you're never too old to start in a way because you're still going to provide protection as you go along. But the sooner you start, the better it is in terms of especially cardiac protection, because women's risk of heart disease increases once you enter menopause, precisely because you don't have estrogen. So estrogen's really protective in those 10 years of up until about 65 in terms of reducing your risk. So it's really, the concern is more if you hormone naive, you've never done it, and then you put somebody on oral.
Gotcha.
Got it.
Okay.
Well, I was just like looking at our various questions, and we were talking about age. And so one of the questions we had in here was that if someone is, say, 45, they're not experiencing any symptoms, can you start HRT proactively?
So, yes, so that's a really good question. Mostly if you're 45 and not experiencing any significant symptoms, it means you're not in full-blown menopause. And it might be somebody who's not really struggling with perimenopause for whatever reason, just because maybe they have a super healthy lifestyle. You know, they eating well, exercising, good body composition, still ovulating, that kind of thing. But most women at 45 are feeling the perimenopause symptoms. So it definitely is a benefit to start.
Maybe we should say 35, a little earlier.
Well, I mean, we could say 35, and actually speaking to 30 to 35, I was listening very intently when you said the part about when your period changes. Could that could be a symptom?
Yes,
and I will say, from a personal standpoint, mine changed right after my second child was done breastfeeding. And I have complained to so many women, and they will say that after their last child,
100%.
it is like massive change. And so now I'm thinking, like, well, was that perimenopause or was that postpartum?
So postpartum, after every child, your hormones can change. It's very common.
Mine changed for sure.
Yes,
there was depression, there was anxiety.
It's very common after number 3 for whatever reason. Yes, but we do see a lot of women have changes between, like suddenly they'll say their periods have changed. But when you were talking about early, so a lot of women 35 to 45 are still possibly on a low-dose birth control. And a lot of times the low-dose birth control, even though it's not ideal, because obviously birth control for the most part is synthetic hormones. They have brought out one that's now got a bioidentical estrogen in it, but not the progesterone. The progesterone's still synthetic. But be that as may, a lot of women say between 35 and 45 are still on birth control, and it definitely does help with perimenopause.
I didn't think about
Now, I will often have women who come in on birth control who in perimenopause, they're getting breakthrough night sweats, their sex drive is gone because birth control will also decrease that. And so I'll put them on progesterone, testosterone cream with their birth control. And so that's a good way of doing it. But the other thing is, when you're looking at people who are young, there's a lot of women who, even before 30, are ending up having hysterectomy or their ovaries removed for whatever reason. For example, endometriosis, if severe polycystic ovaries, that kind of thing. And they're coming to me at 28 and they're in menopause. You 100% need to be on hormone replacement therapy if you're going to menopause early. And so the Menopause Society now has created a whole lot of new rules for that as well, which they didn't really have before, where they're recognizing that it's so important. It's you're medically liable almost if you don't put somebody on hormone replacement. So definitely somebody who's in premature menopause for whatever reason, whether be it that they had a surgery or they had chemotherapy or COVID put them into premenopause or they had a disease or radiation or whatever, or they went into primary ovarian failure, which can happen, you absolutely need to get on hormone replacement because you don't want to be 35 with no estrogen and, 20 years earlier.
Right.
Because you're going to age so much quicker. And it's important as well that those women have bone density scans and that kind of thing. The other young folk that I do a lot of hormone replacement on would be somebody with polycystic ovaries. They very commonly have low progesterone, and then also some people with terrible PMS. So, we do. So you can use hormone therapy all ages, just for different things. And even folk, for example, who've got endometriosis, for example, giving them progesterone can really help with that as well.
Yeah. Interesting.
What do you feel like your I know it's going to vary greatly by an individual symptoms, and it's going to vary based on what combination of hormones you put them on and how it's given. But are there some benefits that you just across the board almost always hear from women once they get on the right doses and levels?
Yes, and the stuff that you won't even see in literature. Yes, the biggest thing is the energy level, and feeling like themselves again. Sex drive is huge. You can restore marriages over this. So I believe it. It's a big
I believe
deal.
that.
Yes,
I really
absolutely. Some of the things that I never expected to hear were, oh my gosh, my migraines are so much better.
Wow.
Or I don't have the joint aches and pains. And I'll even see that, I know this is not about men, but I'll even see that with men with testosterone. They will say, oh my gosh, I can tell my levels are low. I've got all this achiness.
Interesting.
And joint, yes. And so estrogen is a big one in terms of especially hip pain, shoulder pain, just flitting joint issues, just general achiness. People think they've got fibromyalgia, and it's just lack of hormones. So sleep is a big one.
Yeah.
Obviously things like, my hot flashes have gone, my night sweats have gone, my sleep is so much better. But it's kind of the unexpected things. It's like, oh, I forgot that I felt so bad. I forgot this is what it's like to feel good again.
Yeah.
Yes.
Well, and I think some of the things that you were talking about when you said the symptoms that are not necessarily discussed in literature, they are the ones that are much harder, I think, to put to quantify and put objectives into a research study. Like we can talk about number of night sweat or number of hot flashes per day. We can talk about night sweat, sort of, kind of. You can maybe talk about sleep duration.
Right.
But things like sex drive is
subjective.
Subjective. It's personal. And then, is there a scale for that? You know what I mean? So, and energy level, same thing. It's hard to quantify that. And so I understand that it's not in the literature, but it's great to hear that that's what patients can experience.
And that's why so many women sort of get brushed off in sort of a quick average medical consult, because all these things aren't really in the book. So a lot of times, doctors can feel uncomfortable with that, thinking, well, that's nonsense. It's sort of, we weren't taught that those symptoms were part of it. But yet, I hear the same symptoms all the time. I've learned all of this really from my patients, and it's unbelievable how everybody experiences the same thing.
Yeah.
And what a difference, if you just can balance it out a little bit, it makes.
Yeah. Wow.
How about supplements?
Okay, yes.
Because I do want to give a little context for listeners first.
Yes.
There are a lot of supplements out there. There's a lot of advertising. There's a lot of even practitioners recommending supplements to help
their own products.
Manage, like perimenopause.
Yes, correct.
So give it to us straight, Dr. Day.
Yes. So I'm very much in favor of supplements. I love supplements, especially if you use some of the specific ones for specific conditions. I have a thing that I feel like most women, once they enter perimenopause and menopause, should be taking a good multivite. If you're in menopause, you don't have iron in the multivite, a good fish oil with a good EPA-DHA ratio of 2 to 3, calcium, vitamin D, and you pretty much will cover 80% of your bases with that. If you exercise and good lifestyle, etc., those will cover everything. But there's a ton of supplements I use out there for specific things. For example, patients who've got a history of breast cancer or fibrocystic breasts, or they've had a biopsy, or they've had an IFI mammogram. I love this supplement DIM, D-I-M, and it contains this indole 3-carbinol in it, and that's this extract from broccoli. So that's why everybody says, eat your cruciferous vegetables because it stops you from getting cancer. So what the indole 3-carbinol...
They make a supplement with that in there? Because I've read the research with the...
Correct. And so, but you're going to get it more as a physician supplement. And that's the other thing, is you really want to use the good high-grade physician, preferably supplements.
Yes.
And then we can do a whole podcast on that. But... the DIM, for example, the indole 3-carbinol, it protects your breasts from converting estrogen into the bad estrogen. So we have an estrogen called estrone, which is E1. And that's why there's an increase in breast cancer with women once they enter menopause, is because you don't have any estrogen. So the fat that we have in our body aromatizes the estrogen and puts it into estrone. And estrone is a bad estrogen and can precipitate and is linked to breast cancer. So the DIM indole 3-carbinol actually stops that conversion.
Wow.
So, for example, if a patient comes into me and they're on hormone therapy and they've got a family history of breast cancer, or dense breasts is another big one. Everybody's getting dense breasts on their mammograms. I love the DIM supplement because I think it's one of the best ways you can protect yourself from breast cancer.
I didn't know that one.
I did not. And we have talked about... Have we talked about dense breasts on the podcast yet?
I don't think we have. We haven't done
I don't think we have. But as someone who has that problem, I mean, it's irritating because you go for your mammogram.
Correct.
And then they're like, well... Everything looks good, but you have to go do your
ultrasound.
They send me straight for an MRI. MRI, and they're like, so I have to like alternate between the two, and I'm like, I mean, you can't see anything, guys. Like, what can I do to be protected? That's fascinating.
Mm-hmm. Yeah, especially if you're doing the alternating MRI. I usually put my patients on DIM Pro. Well, that's one of the brands is called DIM Pro, but it's DIM.
Yeah.
So going back to supplements, yes, the biggest issue that everybody has, because there's so much about the supplements in the whole TikTok, Instagram, social media space, and every time you see a supplement, you think, I need to add it. So patients end up with a plastic bag full of supplements, which I call the BB shotgun approach. You think if you take enough of that, it's kind of going to be okay.
Best thing you've said all day. Best thing, BB shotgun approach, because that's the truth.
Yes. And then you get fatigued. You get tired of making your smoothie in the morning and then sort of having handfuls of supplements through the day. And
True.
Yes. And then people give up on them completely. So definitely the supplements, there's so many different things that can be helpful. For example, if you're diabetic, yes, it helps to maybe take some berberine, which can help with insulin resistance. If you've got achy joints, the turmeric or the curcumin is really great from an anti-inflammatory point of view. But you really need to be using the right one.
Yes.
You've got to use the micronized, and it's preferable in a capsule because you don't really want to use the powder. So actually... Yes, so we carry supplements. I advise them a lot with my patients. There's another interesting one called Chase Tree, which I use, for example, in patients who've baby polycystic or are having irregular periods and they want to fall pregnant. It helps restore the follicular and the luteal phase of your cycle. So, and then in the menopause space, obviously we all know about things like black cohosh, and then there's a lot of different things, Menopause. I mean, you can go to any health store, CVS, and you'll see there's a bunch of different things for menopause relief. My feeling on that is once you're in menopause and you've got all the symptoms, those products tend to be disappointing. They don't really deliver what they say they're going to deliver. I mean, they can be helpful in perimenopause. And if something works for you, that's great. But honestly, you don't need a ton of supplements, particularly if you are eating a pretty healthy diet and you got your baseline down with your multivit, your fish oil, your vitamin D, your calcium.
Oh.
And I really like women to go on a calcium supplement from about 35 onwards, because that's when we see our bone density. Well, you start losing bone.
Right.
So that's a really protective thing you can do.
Yeah. What is your take? I know, or I've noticed that cortisol supplements, cortisol blends, cortisol calm. There's a couple out there.
Yes.
And they tend to be kind of pricey.
They are.
What is your take? Are some of those worth it, or is it better to take individual kind of things like L-theanine and
the adrenal support products come in two broad categories. The one would be, and just to put it in perspective, I mean, we treat a lot of adrenal fatigue in my practice, and that really is your midlife. It starts happening at about 35 when women have got a career and their kids, and they're just trying to juggle it all. And so basically the stress burns out your stress hormone. So you sort of have subclinical cortisol levels, which can cause the fatigue, and that's when your sort of invincibility factor starts decreasing. You can't multitask or do as much as you used to do. You start just feeling like, I'm just not quite as energetic as I used to be, and that's kind of the adrenal fatigue setting in. So the adrenal supplements you get as an adrenal support, which really has got all the herbs and the adaptogens in it, like the ashwagandha and the L-theanine and some vitamins, etc., etc. And you get a whole bunch of different ones. I mean, you really want to use, again, as I say, a good physician product, ideally. And so that'll often help give your adrenal glands some support to help support it so it can produce more cortisol and you can kind of get your diurnal rhythm back. But once you're really in adrenal fatigue and your cortisol levels are kind of what we call flattened, then the better adrenal support products are one that often contains some sort of natural desiccated cortisol already in it. So similar to like the thyroid medications where you get it from pig thyroid, or it's kind of a desiccated thyroid. So you can get those. And that's also really important because you want to make sure it comes from a good source.
Okay.
So, but then, for example, I'll only use that, if I've done some testing and I can see what your cortisol thing. But that's another whole topic as well, is adrenal fatigue.
Yeah.
Huge.
Yeah.
But that's, So spending money on a good thyroid support or adrenal support, particularly if you feel better with it.
Yeah.
And that's really the litmus test, is how does the product make you feel?
Yeah.
I mean, there's no point spending $60 on a support and it's not doing anything for you.
Yeah. Probably the biggest thing that has come across to me in talking with you is how critical it is to find someone who understands, as you said, kind of the art of prescribing and using these and monitoring lab values and symptoms.
Yes, correct.
I am lucky enough to have you locally, but for people who are in other cities, other states, how do you advise them, or what would you advise to find a practitioner like you?
Yes. So fortunately, we now have a lot of particularly female physicians have got really interested in all of this. We do have all these extra learning opportunities, so to speak, through institutions like the A4M, Integrative Medicine, the Functional Medicine Institute, where you can do all this extra training in not just hormone replacement, not just hormones, but in the whole wellness field. So I do think it's really important for the person to be a doctor or a nurse practitioner who's maybe trained with a doctor.
Okay.
And to know that the person has had the extra training, because this whole new way of looking at hormone therapy is not available in conventional medicine. I mean, most doctors get maybe 30 minutes on menopause. I mean,
oh my
if
gosh.
that. And most of the OBGYNs are very uncomfortable with it because conventional medicine up until now has been stuck in the sort of dark ages with the Women's Health Initiative from 20 years ago, where when medical students and doctors hear the word menopause hormone replacement therapy, they go, cancer, and that's it. That's all they know about it. But there's this huge body of knowledge that's available out there, but you really do have to do the extra courses, go to the conferences, do the fellowships, do the board exams, those kind of things. And so you can look online for, sort of practitioners. You can, the Menopause Society now's got a database for menopause certified practitioners.
Oh, that's awesome.
Yeah.
And then, for example, for the A4M Institute has a thing there has a database. The IFM, which is one of the integrative
functional medicine.
Yes, they've got that. So, and you'll often find that in the bigger cities, there are doctors who are doing hormone replacement. My biggest takeaway for making sure that you get a good practitioner is not just to go to your local med spa where somebody's done a weekend course, for example, on Botox or pellet therapy. You'll often find that the people who actually do it are not the doctors themselves. It may be even a nurse under them. And there's a lot of problems with the fact that they don't know your medical history. They may do labs. Sometimes the labs get lost. The follow-up's really bad because the people who answer the telephone isn't the practitioner that actually was doing it. And so I really would caution you against going to a place where you get a facial and they say, well, would you like some pellets while you're at it? I think that's where the danger zone is. And I see a lot of patients from those particular clinics coming to me who are dissatisfied and have had side effects, complications, levels. It's like somebody goes to a med spa and gets some Botox by somebody who's done a weekend course and it's a disaster, and then they go off to their plastic surgeon and ask them to fix it. Whereas you should have gone to the plastic surgeon or the dermatologist in the first place. So you do need to be cautious. There's a lot of charlatans out there, unfortunately, and so you do have to be really careful.
Awesome. Well, you have some exciting news to share with our listeners. And just so listeners know, Dr. Day has a Substack account. We're going to link that in the show notes. But we're also going to link this exciting news that we have once it's available. So do you want to share what you have coming?
So I have just completed a book, or it's called My Menopause Manual, and it's going to be available towards the end of March. And this is really a handbook or manual primarily for patients and for women who I'm not able to see, where it's really going to cover the whole spectrum of menopause and try and explain everything in a easy to understand, reassuring way, and lots of helpful tips, examples, things that you can do. And so it's not going to cover only hormones. It's also going to cover midlife skincare, hair loss, supplements. There's a huge section on supplements, coping with depression, anxiety. We're going to be looking at coping with stress, managing, we talked about adrenal fatigue, and then also the whole metabolic thing that happens to you in menopause,
Yes.
Looking at how to prevent heart disease, stroke, autoimmune cancer, all these chronic issues that accelerate as we enter midlife. So it's a really comprehensive book, and I'm really excited because I think it's going to be really helpful for patients when they see me. It's in conjunction with their visit, because it's so difficult to sort of get all the information you need or retain all the information.
Yes, I'm
so it's kind of like,
excited.
Yes, well, thank you.
And we will make sure we will update these show notes once it's out with the link, but we will also share it through our other social media outlets. Thank you so much for joining us.
You're so welcome. It's so good to talk to you both.
Awesome.
Thank you so much for joining us for the Happy Eating Podcast. I'm Brierly Horton.
And I'm Carolyn Williams. If you liked this week's episode, then don't forget to rate and leave us a review on iTunes. And be sure to hit the subscribe button so you'll never miss a new episode.
We can't wait to have you back at our table next week for a brand new episode. Bye.
The contents discussed in the Happy Eating Podcast, such as advice, studies, text, graphics, images, and other material discussed or presented on the site or podcast, are for informational purposes only. Content is not intended to be a substitute for medical advice, diagnosis, or treatment. Always seek the advice of your mental health professional or other qualified health providers with any questions you may have regarding your condition. Never disregard professional advice or delay in seeking it because of something you have heard on the Happy Eating Podcast.
If you are in crisis or think you may have an emergency, call your doctor or 911 immediately. If you're having suicidal thoughts, call 1-800-273-TALK, that's 8255, to talk to a skilled trained counselor at the National Suicide Prevention Lifeline. If you are located outside the United States, call your local emergency line immediately.